Evening to everyone present here, and special thanks to the Hindu for collaborating with us this evening. And thank you everyone for signing in, taking your time and signing in. I hope everyone is doing well and safe. I'll just take a second to share my slide. I think you just got a glimpse of my speech there for a second, but before. Right, so is my first slide visible, Sarina?
Yes, it is.
Yes. Right, great. So yes, as the pulse of this meeting has actually been set by Professor Ramachandran very nicely. He discussed about how the COVID pandemic has literally changed our lives. The pandemic has literally taken us all by storm. And we have learned a lot of things. It has taught us a lot of lessons. But from the medical point of view, I think one of the most important things that we have come to learn, and the most important factor, is that it has further reinforced the importance of blood glucose control and the importance of keeping your blood glucose on check for patients with diabetes, especially to improve your immunity levels. We all know, and we heard even from the previous discussion, that there are various risk factors which increase the risk of complications due to COVID infection. The manifestation of COVID infection has been very, very varied, and it's taken us by surprise with every new case that we see. But one common factor that we found is that those with comorbidities, which include diabetes, hypertension, obesity, cardiovascular risk factors, these are the patients who are at higher risk of both the complications of COVID infection and also higher rates of death as well. So as we heard from the previous discussion, we actually conducted a study, and from this particular analysis, we also came to know that the higher your HbA1c, and for the benefit of those, I'm sure many of you do know what the HbA1c is, but for those who do not know, the HbA1c indicates how your blood glucose has been over the prior 3 months before testing, right? So what we found from our analysis and from the studies that we conducted and the papers that we have published is that for those who had a higher HbA1c at baseline or at COVID infection, the risk of complications actually started increasing much higher. So when we divided patients to a HbA1c less than 7 and those with a HbA1c more than 8 or uncontrolled diabetes, usually a good HbA1c is less than 7. So those with a HbA1c more than 8, which indicates poor glycemic or poor glucose control, the risk of complications, which includes the lung complications, the heart complications, the kidney complications, and also death rates, just jumped up sky high. And so it was, we concluded from that the higher the HbA1c increase, the higher the risk of complications and death due to COVID infection. So what we can conclude from this analysis is that it is extremely important to keep your blood glucose under check, to improve your immunity, and to have the capacity to fight this COVID infection or any infection for that matter, but particularly during this pandemic, it is extremely important to keep your blood glucose under control, and in other words, keep your HbA1c under control as far as possible. Now, there are many challenges that patients face, and even clinicians or doctors face when it comes to treating patients with diabetes and COVID infection. Some of these, most important, is that the blood glucose tends to shoot up once there is a COVID infection. There are some reasons for this. The first most important is that the virus or the infection itself and the stress that the infection causes itself can increase the blood glucose. And this is what is called stress hyperglycemia, or the inflammation, or the so-called cytokine storm. I'm sure many of you have heard or come across in literature. This inflammation or the whole stress that the body is put through during an acute COVID infection itself can increase the blood glucose levels. Number two, the various treatment modalities, the various drugs that are used, including especially the steroid therapy, which is a life-saving drug in patients with severe or even moderate to severe COVID infection where they have lung involvement. Steroids are literally lifesavers, and it has to be administered. And when we administer steroid therapy to patients with COVID infection and those with pre-existing or in patients with diabetes, the blood sugar again shoots up very, very high because the steroid is a what we call a counter-regulatory hormone that increases blood glucose levels. So these are factors which increase blood glucose levels. Now, beyond this, there are other challenges that patients face. There are patients who get a lot of vomiting, they have diarrhea. These are very common symptoms due to COVID infection. There are patients who have loss of appetite and are unable to eat very well, loss of taste, of course, loss of smell. These are all challenges that patients face during the COVID infection, and this becomes a challenge especially for people with diabetes. Now, what happens is because of these particular situations that patients are faced with, we do have to have certain modifications in their routine diabetic medicines. And these modifications, of course, I'm not going to go into too much details of it because it will be too medical for the sake of the audience. I'll just sort of give you a gist of it. There are certain drugs which may not be and may not suit patients during an acute crisis or during an acute infection like vomiting or whatever, sepsis or whatever the infection may be. And these drugs may have to be withheld. Secondly, patients may also require shifting over or transition to insulin therapy. And this insulin may be temporary, which may gradually then be withdrawn later on once there is recovery. So these modifications in therapy and initiation of insulin, all these require expert care from your diabetologist. And many patients who are in home isolation, many patients who are not admitted and who are at home, do not have access to their diabetologist, to their clinic, to their doctor who's treating their diabetes. And that is where Diahome comes in hand, because this is an app that connects the patient very easily. And we are still treating a lot of patients with COVID and diabetes and helping them out at this particular time. The next aspect, of course, is that even in patients who were previously non-diabetic, there are new entities of hyperglycemia or new manifestations of high glucose that we find in some patients when there is COVID infection. The first one was the stress-induced hyperglycemia, which I was talking about just a few minutes ago. But the other new type is the new onset diabetes. And this is something very, very peculiar, one of its kind that we are just seeing, in which what happens is the virus, which is the COVID-19 virus, attacks the pancreas, and in fact, the beta cells, which are the cells that release the insulin hormone, which is responsible for blood glucose control, is actually attacked. And because of this infection of the beta cells, there is a deterioration in the pancreatic function, or the so-called endocrine pancreatic function. And as a result, because of this, these patients develop what is called a new onset diabetes, which is a very peculiar type of diabetes, which may be autoimmune, which means that patients may require insulin. And we are yet to know, to find out a lot more about this new onset diabetes. Beyond this, now we are in a particular, moving on to a phase where the number of new COVID infections is coming down. However, a lot of patients who do recover from COVID infection are still not completely recovered because of the so-called long COVID or the post-COVID syndrome or the post-COVID sequelae. Now, this is a particular scenario in which patients, even after the virus has come and gone, the acute infective phase has actually gone, and the virus is out of your system. And yet, patients still struggle because they have a lot of difficult symptoms to deal with, and some of them can range from tiredness, severe lethargy, severe body pain, muscle and joint pains. Many of them still have cough, and due to this, they also have shortness of breath. They're not able to climb even a set of stairs. A lot of people even have disturbed sleep. Some of them even complain of hair loss. And beyond all this, the most troubling aspect is the psychological aspect that comes with the post-COVID, in which patients go into also a severe depression, anxiety, and even a sort of a brain fog, which is what we've come across, where patients are not able to think very clearly, and they definitely do need some help. So this scenario in which patients go into this long COVID can last once the infection is completely, if the acute phase has come and gone. This long COVID can actually last for 1 month, 2 months, 1 week, or even as long as up to even 6 months, which is what we found even in the previous wave. And even in this second wave, we find a lot of patients who suffer from this pain and this body pain. So there are factors to keep in mind for those patients who are suffering from this long COVID or the post-COVID sequelae, or those people that we know. There are certain recommendations for this post-COVID-19. The most important for those people with diabetes is to keep your blood glucose under check, because even after recovery from COVID and even after you discontinue your COVID medication, there is a certain period of time where during the recovery period, patients do still struggle to bring their blood glucose under control, because the various the stress that the body has been put through takes some time to settle down. So that and many patients who have been initiated on insulin during the acute phase of infection and just out of the hospital or even at home in the post-COVID phase, stabilizing your blood glucose and that transition from insulin to your older therapy or your older medication and bringing it back to baseline and controlling your blood glucose must be very delicately handled. At the same time, patients also, because of their loss of taste, loss of appetite, it is extremely important to get a good diet plan and consult your dietitian. Eat a good, nutritious, healthy diet. Make sure you get a good amount of protein and fiber with nutritious food, fruits and vegetables, and maybe nuts if you can include that in your diet as well. At the same time, when it comes to resuming exercise, there's a lot of factors that need to be taken into account, because patients who in the post-COVID phase, sometimes because of the breathing difficulty and the cough that persists in the post-COVID time, it is very, very important to take it one step at a time. Do not try to go back to your pre-COVID exercise regime where your intensity of exercise and your stamina was very good. It may take some time where you take tiny steps, and that goes a long way until you can actually reach your pre-COVID capacity for exercise. So it is very important to take all these factors into consideration. And then last but not the least, also psychological counseling. For those who do require help in psychological counseling, please do reach out to your, do not feel afraid to reach out to a counselor to help you with your psychological status as well. And family support from your friends is extremely important. So Diahome has actually brought together all these aspects, and post-COVID rehabilitation is something that we are also specialized in. Of course, I would like to end on a positive note that the only solution that we have at this point of time is the vaccine. And for those of you who are not yet vaccinated, please do go ahead and get yourself vaccinated. For any further doubts, I think in the next talk, Dr. Arun will be elaborating further on that. Thank you.